Thank you guys so much for joining us today. We have the lovely and talented Dr. Jennifer Vickers with us here today. Beyond excited to have her. She is dual board certified as a dermatologist and a dermatopathologist. I think I got the word out. Am I good? I did.
That's perfect.
And then
Perfect.
she practices at our Bee Cave and Lakeway location as well as our Central Austin location. So she is a woman that wears many hats. Thank you so much for joining us today.
Well, thank you for having me. I appreciate the invitation.
For sure, for sure. So we're going to talk about one of the funnest things, I think, in dermatology, which is injectables. So I'm going to go ahead and share my screen really quick so that we can get this show on the road here. Let's see. Share. Okay, can we see my screen? We're good to go. Okay, so let's see. Injectables. So injectables actually means quite a few things, and we'll go into that in just a moment. But the first thing I think is super important for us to chat about is the facial aging process. I think in order to be able to treat or understand where you might want to treat, you have to kind of understand the aging face. So who better to explain it to us than Dr. Vickers? So share with us a little bit.
Well, thank you. Taylor, I think I'm just seeing your desktop. I'm not actually seeing the presentation. I don't know.
Perfect. That is something that I will fix right now.
And I wish my desktop were that organized, by the way. Mine's a mess.
Oh, it's horrifying. Whoop.
Okay.
Are we good to go?
We're good to go. I can see it now.
Awesome.
All right. So, yeah, so Taylor was talking about, kind of stepping into discussion about how we age, because I think that's really important to understand that when you are trying to decide if you want to have any of these procedures or just understanding what it is that we do. So I love to present this slide when I give a talk about aging. Sigourney Weaver is one of the only celebrities that I can find who I don't think has had much done, if anything at all. And so she's a great example, and she's very recognizable. She's been in Hollywood for a really long time. So we can see the first picture of her there when she was young. And, when I'm able to interact and give this presentation, I like to ask people, what is it that draws your eye to that picture? And usually what people will say, Taylor, if you want to do a little click for me there, usually what people will say is, it's her eyes. That's the first thing that we see. So then as we age, the things that we kind of pay attention to, or what draws our attention, changes. And so you can see as she ages, what is drawing your eye is the bottom part of her face. And that's because everything kind of starts to move downward, unfortunately. And things start to elongate, and they become a little bit droopier, and the eyes become a little bit smaller. And so we start to notice more of this. So as a dermatologist, or as somebody who is working to do rejuvenation for my patients, what I want to do is change the focus from here to here, because that is going to make the people who are looking at you think that you're younger. And that is what our brain tells us. So actually, can you go back one more? Sorry about that. I just want to talk a little bit about those pictures down at the bottom. That is showing the bony and soft tissue changes that we see with aging. So we have all these fat pads. You can see the lower left picture. We have all these fat pads in our face. And when we're babies and kids, they're nice and plump. And they get smaller and smaller and smaller as we age. And that's why we go from having the cute little baby, chubby baby face to having a much thinner face as we get older most of the time. And when that happens, it starts to separate. And those separations will bring on lines and crevices and things that we weren't used to seeing when we were in our 20s. In terms of bony changes, you can see sort of resorption of the jaw. You can see elongation of the aperture of the eye there. So everything is just sort of elongating, getting a little bit smaller there. And that goes with muscle, bone, and fat. Okay. So this picture shows a mother and a daughter that are pretty far in age, and they look very similar to each other. So you're able to see a lot of the changes that occur. As I mentioned, the fat pads will start to separate because they're getting smaller. You can see that in the older lady because she has a lot of spaces or sort of denotations between her fat pads, say under the eyes, kind of under the face here. Everything is kind of starting to move down. She's developing what we call jowls, which I hate. And everything's sort of flattening here. And there you can see them side by side. I like this picture because it shows the differences from the side as well. We think about things from the front, but there are changes from the side also. Things start to move backwards, get a little bit flatter. You don't have as much interior projection. So again, when I'm doing rejuvenation, I want to do things that sort of bring the face forward like it was when we were younger. So typical youthful features: smooth skin without deep wrinkles and folds, even skin color, high cheekbones, full cheeks, defined jawline. My jawline is getting less and less defined every year. Thick fat pads, good bone structure. And then as we age, that triangle inverts. And like I told you, it's more of a focus down here. You start to set in those lines. You get sunspots, the vessels start to dilate, you get drooping skin, the jowls, the sagging jawline, the flattened cheeks, and then of course the dreaded turkey neck or double chin there.
Well, it sounds like we have a lot of things to be excited about.
Oh yeah, so much. And this is all, it's all part of aging. It's better than the alternative. So muscles in aging, what do we see with this? So, if you make this face all the time, which we do, if we're concentrating or we're frowning at our kids or frowning at our spouse, we're going to start etching this in. And that's when you get those 11s. And that is something I actually pay a lot of attention to, because if I go back to my hometown and I see people who I haven't seen in 20 years and they look older to me, I think, what is it about them that makes them look older? And that's one of the things that comes to mind, is they start to etch in here, and that really can age you. And, for younger people who have really strong glabellas and those lines are starting to etch early, they start to look older sooner. And so we're going to talk about ways that we can kind of offset that. Forehead lines, crow's feet, all of these things are going to start to etch in after a while just because of repetition. I talked about this a little bit already. You have the separation of the fat pads, which can, give you the hollowing under the eye. You can start to see like jowling and lines around the mouth. Things get a little bit saggy here in the fullest end of the chin because we don't have as much scaffolding, is the word that I like to use. So if I pull up my face here and I give myself more scaffolding, all of this becomes smoother. But unfortunately, it's not going to stay there because, just as I've aged, some of those things have started to resorb and get smaller. And so everything starts to move southward.
Okay.
All right.
So you built us up. We're getting excited.
Yes.
Tell us how we can go back. But tell us a little bit about how something like neuromodulators can help with some of the concerns that we've mentioned already.
Okay, great. So neuromodulators, something like Botox, Dysport, what that does is it relaxes muscles. And somebody who's doing an injection with those medications needs to have an understanding of, when I inject this muscle, this is what's going to happen, because it's kind of counterintuitive sometimes. So patients will tell me, oh, I need some more here. And I'll say, well, actually, if what you're trying to achieve is this, we need to put it here. So having a good understanding of the muscles and how they work and what we can do with the neuromodulators can make a big difference. So we can treat wrinkles on the forehead, the glabella here. I talked about those areas already, the crow's feet, the bunny lines. We have lots of areas and we'll go over some of those. Pros of doing something like a neuromodulator: there's very little to zero downtime and minimal bruising. We use very tiny needles. We do work at not hitting vessels so that we don't cause any bruising. Unfortunately, you can have some little bruises, but it's usually pretty minimal. Results kick in at about a week, sometimes sooner, and then they're fully in effect at 2 weeks. So it isn't an immediate result, but it is pretty quick. And then the results last up to 4 months, and you'll start to see it wear off, over time, but usually between 4 and 6 months, it's completely worn off. So let's say you get it done and maybe there's something about it you don't particularly love. That is a pro also, because it will reverse and then you can fix it.
And to counter that, if you love the response, what's really good is when you keep consistent with your treatments, you can kind of try to fight that like wearing off of the treatment, and then you don't see that as much and you stay pretty consistent with your results, which is really exciting. Yeah,
but I definitely have patients who they have their schedule, and so they keep it going. Yes, they keep it going all the time. Okay, so here are some of the areas that we can treat. We can do some things to give some lift to the brows. We can treat the bunny lines. I definitely have bunny lines here. So we treat this muscle and that can kind of relax those as well so they don't start to etch in. Even a gummy smile. So for people who smile in a lot of the gum shows or the teeth show, we can relax some muscles to kind of help minimize that. A good example of that in Hollywood is Jennifer Garner. You definitely, I've seen articles where it shows before and afters of her treating her gummy smile. Vertical lip lines right now, all the rage is this lip flip. So we can do a little bit of neuromodulator there, and it just gives you a little bit show on the lip, but it also smooths out those lines. And there are other things we can do to treat that as well. So we'll get into that in a minute. You can help a square jaw if you have kind of a more masculine jaw and you're not wanting a masculine jaw, then you can do some neuromodulator into here to kind of thin out the face a little bit and make that masseter shrink down a bit. There are medical reasons we would do that as well, such as like TMJ disease, that sort of thing, but this is cosmetic, so we're going to stick with that. Dimple chin, we call it the golf ball chin. My mom always tells me she can tell when I'm upset when my chin is dimpled, so maybe I should be better about getting this here. But you get the little indentations there. We can relax that with the neuromodulators as well. Neck bands, over time, we get these platysmal bands, which will age us. Those can be relaxed with neuromodulators as well. And then, of course, the classic forehead lines, frown lines, or the 11s here, and crow's feet. Those are like the most common areas that we treat. All right, so this is just showing you some before and afters of what we can do. So it looks like on the right that this gentleman is not making his frowny face, but he is attempting it. And I can see that there is a little bit of some movement there, but not very much. But that goes to show you how well we can prevent you from being able to make this face. So just look at those before and afters, kind of get a sense of what that's like. Ideally, it also will kind of lift the medial brow as well so that you look nice and refreshed. So you can see that with this before and after as well. So she's frowning in the left-hand picture. She probably is trying to make a frowny face in the right hand, and she isn't really able to make those lines. Now, that is to say, I think some people get a little bit worried that they can't make any expressions when you do Botox. There is a spectrum of how much we put into the muscles, where you can be completely frozen and not make any face. And I have some patients that ask for that. And then some patients who really want a little bit more movement, a little more of a natural look, and that is an option. So don't feel like it has to be all or nothing. Crow's feet, really great example of that. Hers are nice and relaxed. She's still able to smile with her eyes, but she just doesn't have the lines on the side of the face here, and it will prevent it from etching in over time. Forehead lines, these horizontal lines are created when we use our frontalis muscle, which is this V-shaped muscle here. So when we lift up, we start to create horizontal lines that will etch in over time as well. And we can relax those with neuromodulators so that they're nice and smooth, like you see on the picture on the right. And over time, nice and smooth, even as we age.
And spoiler alert, she did mention, Dr. Vickers did mention that it will etch in over time. There are ways to be able to treat these concerns over time. We do have a texture and pigment webinar coming up in a couple of days. And that is a great way. There are many ways to treat that. And the best way, beyond watching the webinar, is to meet with your preferred provider and having a consultation, because everybody's case is different. And you may not need as aggressive of a treatment, or maybe the way that the provider likes to go about it is a little bit different. So anyways, it's really important to have a consultation to figure out how to treat your specific concern.
Absolutely. And I do think it's very important to remember and understand that when we do these things, when we're fighting aging, you want to use multiple modalities. You don't want to just go with one or the other, because you're not going to get the best results. Doing things that sort of address texture, like you said, pigment, but also the muscles. I mean, these are all approaches that you can take that will give you the most bang for your buck. All right, so this is Dysport. A lot of people ask me, what is the difference between Dysport and Botox? The quickest answer is it's Pepsi and Coke. Some people prefer one, some people prefer the other. There are some minor differences between the two, but for the most part, most people who are doing injections should be able to sort of use those interchangeably. Just wanted to throw that out there. So this is just showing again how we can kind of smooth the forehead, smooth the glabella. So you can see the top pictures are her befores, the bottom pictures are her afters, and she's got this nice relaxation going there that just makes her look more refreshed.
And what's awesome, I think, is even at rest, you can see in the bottom that her etched in lines have smoothed out a little bit, and it didn't state that she had anything additional done, which is very exciting. So even just a simple treatment that takes like maybe 10 minutes in the office can make such a huge difference.
So again, using a little bit of neurotox or neuromodulator to the glabella just gives a nice relaxation there. Should kind of open up the eyes a little bit. And that's just showing forehead lines from the side. And this is that platysmal banding that I was talking about. So over time, these bands will actually start to kind of hang around even when you're not making this face. And that will, again, age your neck. And so we can relax those platysmal bands. You can see on the right, she has a nice smooth neck for the most part, and she doesn't have the bands there any longer. That's the dimpling of the chin. She's got a little golf ball chin. It's relaxed over on the right, so you don't see as much of the dimpling. Okay, so I'm gonna turn that over to Taylor so he can say a little something here.
Yeah, for sure. So now that we know a little bit about how to treat those lines in motion, which is something that neuromodulators are able to help with, a lot of what we went over in the anti-aging portion or the aging face section was talking about kind of like scaffolding and kind of building up the structure, which has a lot more to do with volume loss. So I now hand the torch back to you. So tell us all you know.
Okay, great. And I'm actually glad you said that, because a lot of people, I think, get a little bit confused about what do we use. I'm just going to say Botox. There are lots of other brands out there. Botox is kind of like saying Coca-Cola. What is the difference between doing Botox and fillers? Botox, for the most part, while we can use it down here in some ways, it's mostly going to be for the upper face. And fillers, for the most part, is going to be for the lower face, although we can use it in lots of different areas. We'll get into that. But that's just kind of the, quick and fast rule: upper face Botox, lower face fillers. What we're using fillers for is to address volume loss. So we're no longer looking at relaxing muscles and addressing fine lines and wrinkles. We're really trying to get in there and give some lift and also give some smoothing. So this isn't going to be for the little etched in lines. This is going to be more for the deep grooves that happen over time as our dermis starts to thin and we start to lose fat and muscle and all of those things that we talked about. So places that we can do that: cheeks, lips, nasolabial folds here, your marionettes. Those are kind of the most common places. And obviously everybody, like Taylor said, everybody's a little bit different. So there could be other places that, your provider would want to address, but those are going to be the most common. Downtime on that, I would not do that when you have something coming up like a wedding, like that weekend. A patient that comes in and says, treat my under eyes and I have a wedding in 4 days. I would not recommend it. You could have some bruising. We are putting needles into the face. There are vessels there. And if you don't want to go somewhere with a bruise, then I would say give yourself plenty of time before your event, before you come in and have a treatment done. You will have some swelling in some circumstances as well. And so you definitely want to account for that. Those things usually go away in about a week or two, and they're going to get better and better as time goes on. But I'd say give at least a good 2-week window before you get your treatment. To get your treatment done before your event comes up. The results are immediate. So that's one of the advantages over something like the neuromodulators. You're going to see improvement right away, which is really fun. That's one of the fun parts about actually injecting it, because you do the injection and you see your work immediately. Duration can vary. For the majority of the products, we usually estimate about 9 to 12 months, some of them up to more 15, 18 months, some of them 2 years plus. It really depends on what we're treating, how much movement happens in the area. So the more movement, the more quickly it breaks down. So around the mouth, it's not going to last near as long, but it still lasts a good while. How thick the product is, all of these things. So it really can just depend on the product.
Yeah, what I really love about that is the longevity of a lot of those products, and the fact that it really is an investment, and how if you partner that with other procedures, it really can help impact your concerns about aging. Oh, there we go.
There we go. So those were just a few of the products that we use at Sonova. And honestly, it's not really, again, they're all very similar, and it just kind of depends on what it is that you're wanting to treat as to what you would use. Okay, so areas that we can fill, definitely the cheek area. We can do a little bit in the anterior areas to give back that anterior projection that I was talking about, to give you a little bit of lift here. One of my favorite places to inject is right along the lateral cheek. And I just kind of march along that cheekbone, and that gives you that nice lift. Now I tell patients it's not a facelift, so it's not going to do this, but it will give you just some nice lift. And by doing that, you can address here, here, here. So it kind of gives you a nice overall improvement, and then you can go directly into those areas if you want to do further improvement. Tear troughs under the eyes, that's a good candidate for that is someone who has more hollowing rather than bulging. The parentheses lines, the NLFs here, the lines around the mouth. If somebody wants fuller lips or even smoother lips, some patients just don't want their lips to look so lined. They want them to look more hydrated, and we can do that as well. The corner lines here and the marionette lines, which are those that come down here, as well as lines on the chin. So those are, I guess, kind of the standard areas, but definitely there's a lot of quote off-label things that we can do. And we'll get a little bit more into that. And some of that can be even more about improving things that you don't like about your anatomy at baseline, not even necessarily aging, but things that we can do to sort of balance out the face, make you feel more comfortable with certain areas that maybe you don't like as much as others. So we've got some more before and afters. And by the way, most of the ones that we've seen so far are from Suzanne Bruce and Associates. That is a group that is with Sonova, and they have kindly let us borrow their pictures. So I will show you a picture of one of my patients, but most of these patients are just examples. So this patient had some filler done. And filler is made out of hyaluronic acid, which is a ground substance that's already in the skin. It's in the dermis, and it does break down over time. It can be reversible. So let's say we do an injection and something about it just doesn't sit well with you. There is the option to use a substance to reverse that. Now, that does not happen very often at all. Most of the time, people want their filler to stay there. But I think just knowing that that is a possibility makes people feel a little bit more comfortable. So I do want to throw that out there, but it is not something that happens often at all. So this patient has had some enhancement in the cheeks. Her under eyes, you can see that hollowing is definitely improved. Looks like she probably has a little bit of a bruise there, so she probably had it recently. And then a bit in the chin, the marionette zone here, and the nasolabial fold. So she's kind of had things all over the lower face. And overall, she just looks a little bit more refreshed, a little bit smoother, a little bit younger, but still very natural.
Yeah, I love the fact that it's one of those situations where I feel like A, she looks super rested, which I think we're all jealous of.
Oh yeah.
And then B, you can tell that she might have had something, but you don't know what it is. And I think that's like the best work, is the natural look that you were mentioning. And I know that all the providers that we have at Sonova, that's their main focus, is not to make you look overdone per se. If you want to highlight a feature, they're more than happy to talk to you about that. But their end game is to make you look like a more refreshed and a more restored you, which is very exciting.
Absolutely. This is just showing some emotion so that you guys can see more than just like these flat before and after. So if you want to watch her for a second, you can see that things are just smoother. There's a little more plumping there. Looks like she probably had nasolabial folds. Oh, it says it right there, nasolabial folds and marionettes. So you can see like there's a little bit of more volume here when she makes that O face there. That is just showing you in motion again. Just nice softening. This one is nice, and it shows that anterior projection that I was talking about. So this is 2 syringes, probably a syringe and a syringe, and it just gives you that nice apple that starts to flatten out as we get older. But again, still a nice natural result. Okay, so this patient had a little bit of a mix of things, and most patients do. Most patients have a little bit of neuromodulator and a little bit of filler. So in this case, she had her masseters done to kind of thin out the face, make her jawline look a little bit slimmer. And you can see the difference there. The vertical lip lines, you can see that lip flip, and that her top lip is just a little bit more enhanced. It's not crazy. It's just a little nice enhancement there. Her DAOs, which are these muscles right here, and what that does is it gives you a little bit of upturn to the corners of your mouth. And it's just a nice little pleasant upturn. So some people some more than others, the corners of the mouth will start to go downwards as we age. And even just as part of our natural anatomy, you can do a little injection here, and then it'll give you a nice little upturn of the mouth. And then she had some mid-face enhancement as well as the piriform aperture, so around here in the nose. And then chin, jawline, which you definitely can tell she has a much more defined jawline there, and then temples as well.
I love that you can see how the light reflects on her cheek in the after photo, because I definitely can resonate with the first photo where I feel like over time my face has just kind of become kind of flat. And I love, it really does kind of, I feel like almost give her years back on the right-hand side
Yeah, absolutely.
with that definition.
All right. This patient, now the first thing I do want to mention, just to get, to address the elephant in the room, I do believe this patient had a nose job, okay, like a surgical nose job. So we're not talking about that. That is not filler, okay? What was done in this picture in terms of filler was actually her jawline. So you can see she sort of is starting to have like a little bit of some waving there that happens when we lose muscle and bone and fat and all of that. And so we can kind of smooth it out, which gives a much more youthful appearance, gives her a little bit more projection in the chin as well. So you want it to kind of line up with the lips and line up with the nose. And that sort of gives some nice balance to the face. I would imagine if you saw her from the front, you actually would be able to see more balance in the face from doing the chin as well. Just as an aside, we can use fillers to do what's called a non-surgical nose job or non-surgical rhinoplasty. It is one of the more risky procedures that we do, but it is something we can do. And that's something we could counsel people on if they're interested in it. And we just put a little bit of filler along the bridge of the nose to make it look a little bit straighter. And it really is quite amazing how much of a difference it can make. Obviously, that is not a permanent change, so you would have to do some upkeep. And again, it's one of the riskier areas to get injected. So go with somebody who definitely has some experience, knows their anatomy, and knows what those risks would be and where is safe to inject and where is not. And I do that procedure in my office here and there with the right candidate.
Love that. Got to play it safe.
So this is demonstrating under eye. So she has some hollowing here and just placing a little bit of filler into the tear troughs. That's what we call that area, is the tear troughs. I like the way that Taylor said this. It changes the way that the light reflects as well as also filling. And so she doesn't have that hollowing and those dark circles under the eyes as much in that lower picture. And so you definitely see some nice improvement there. She does not look as tired. So perioral lines, another one of my favorite things to do. We would use something that is going to be a little bit thinner in that area because we do need to place it more superficially. And so we do just kind of thread the filler into those little lines, fill them in. It is super satisfying. We can do that around the lips, the chin, around this area as well. So that is more for like, that's where we can use filler for fine lines. I told you we don't really use it for fine lines and wrinkles. In this case, we can use filler for fine lines and wrinkles. I also like to give a little bit of volume just in that area in general, so you don't continue it to make those crevices. This patient also had some filler to her lips. I think a lot of times patients are worried that if they get filler to the lips, they're going to end up with those crazy lips that they see online or on TV. This woman had 2 syringes to her lips and they still look very natural. She does not have duck lips. She does not have anything that looks out of the ordinary. They look more hydrated. They look a little plumper, a little bit fuller. And again, that's going to come with picking somebody who has experience and knows what they're doing. Another example there, just a nice little enhancement. She had good volume to start. There wasn't really a lot of volume that was added there. It was more just enhancing what she already has. So shaping, giving her a little bit more show where the lips just look poutier and a little more youthful. And I think this is the same patient actually. So you can see how it's fitting her face really nicely. She does not look like she has these unnaturally large lips. It actually kind of gives her some balance. And from the side, again, you can see more interior projection. Again, this patient just had some lip filler done as well. Looks like there was some smoothing happening, not a ton of volume added, which is nice. I think it just, again, enhances what she already has. So one of the things that Voluma has been indicated for recently is for use in the chin. Voluma is a product that is a little bit thicker, a little bit heavier. It's one of my favorite things to use. I love to use it for lift, but it also is really nice for giving some projection to the chin. And interestingly enough, if you look at this patient, you almost start to think like, did she have something done to her nose? Did she have something done to her lips? But at the end of the day, just giving her a little bit more chin gave her more balance to the face, makes her nose look a little less prominent, makes her lips look a little bit more prominent. So by enhancing other areas of the face, you can actually bring out features in a patient that are nice, that are lovely. Same with this patient as well, had a little bit done to the chin. He has a little bit of a chin that goes in. It probably was something he was self-conscious about. So you just add in a little bit of filler there. You have some nice projection. It gets a little more even with the lips, adds more balance to the face, gives them a more masculine look in this circumstance. And so it looks really nice. So this is my patient, and unfortunately, I don't have pictures where the lighting is perfectly uniform from picture to picture, but I just wanted to show you guys an example. This is one of my absolute favorite patients. She has been seeing me for a few years now, and in fact, her before and after is almost exactly to the day 2 years apart. And so we've done a series of things over time. We have done some under eye filler. I've done her chin, her jawline, her cutaneous lip here, her NLFs. I've done some anterior cheek and some lateral cheeks, so you can see a little bit more structure to the cheeks here. You can see that she looks more refreshed here. She's kind of up for anything, and she's usually pretty excited with whatever it is that we do. I've also done a bit in her lips as well. I wanted to show the picture on the right. The before and after, she's at a resting face, and I thought that probably would give you a better idea of a comparison, but I wanted to show you guys what she looks like smiling as well, because I do think it is nice to see how it can enhance the features with smiling, and also how happy she is with her results. And one thing I want to emphasize with this patient also is that you can do little, we call them tweakments. We can do it over time. We do not have to do everything on one day. So this is, you know, she comes in and sees me maybe every 3 to 6 months, and we kind of do a little something else. We do a little bit more here. And over time, we really have seen some great rejuvenation of her face. So she is 2 years older in the picture on the right there than she is on the picture on the left. But to me, she looks younger.
That's crazy. I would never have guessed that.
Mhm.
I mean, obviously you've told us that, but thinking about it in that standpoint, she looks like her daughter. It's very interesting.
Mhm.
Yeah, I love that the option of kind of treating here and there, the idea of potentially using this as an opportunity to talk about full correction.
Mhm.
You know, it doesn't all have to happen in one appointment, but addressing the various signs of aging can help kind of offer a well-rounded result.
Absolutely.
So we've talked about the lines of motion, and we've talked about volume in one capacity, but something that I know that you're super excited to talk about is Sculptra. So kind of give us the rundown of what Sculptra or a biostimulator is.
Great. I think this can get a little bit confusing at times. I think people think of Sculptra as being a filler, and it's not a filler. It's actually, as you said, a biostimulator, and it's a volumizer. So when we're using filler, we're kind of aiming to fill in a space. We're filling in a line, a crevice, that sort of thing. When we use Voluma, we're really looking to give overall volumizing, and we can treat certain areas, but for the most part, it's going to be an overall volumizer. So one of the things I think that makes people shy away from Sculptra is that it's not an immediate result. It does take time. What it's doing is it's stimulating your own collagen, which is wonderful, because you know it's going to give you a much more natural result, a very long term result, because obviously this isn't HA that's going to break down over time. This is your own collagen. It also helps with the integrity of the skin, and I think it's important to mention that because like I said, doing one thing for rejuvenation, yes, it's going to improve things, but if you want to get the best result, you really kind of have to come at it from different sides. And one thing that people forget is the integrity of the skin. Our dermis does get thinner as we get older. Everything gets a little bit thinner as we get older. And when you add in that collagen, you're giving yourself that collagen back. And so, it really can improve texture, tone, all of that. This patient just had 2 vials, which sounds like a lot, but it's not filler. So it's going to be placed in lots of different areas. It's liquid that we're going to inject. It's going to plump up the face immediately, but then that's going to kind of resorb and then build back up again over the course of months. So I think she has a really nice result. You can see some volumizing under the eyes. You can see some volumizing around the cheeks. But again, she looks very natural, just more rested. And that's from the side. So you can see a little bit more of what it looks like from that angle. So again, under the eyes, around the cheekbones here, a little bit in NLFs, she has some softening and some volumizing. One of my favorite patients to treat with Sculptra is a patient that has a very thin face, because you start to see more hollowing with someone that has a thin face. And this patient is a pretty decent example of that. She has a few different areas that we could treat. So in this case, it looks like they probably addressed the cheeks, under the eyes, the NLFs, maybe even the temples, because her temples look a little bit fuller. And I think that this is a place that gets forgotten about a lot, but it really can make a huge difference. So if you look at her before and her after, again, overall volumizing, there's not one area where you're going, oh yeah, I can see where she got that improved. It's an overall improvement, and it's a very natural result. Down at the bottom, you can see that nice anterior projection that I was talking about that makes you look younger. This patient is another great example of somebody who has a thin face and some hollowing. So I have a lot of patients that do not like the hollowing here. And so they're a great candidate for Sculptra. You can see in her after pictures, she still has nice sculpted cheeks, but it does not look as hollow. Also, it looks like they probably addressed her temples, under the eyes, and she really does look refreshed and young in those after pictures compared to her befores. Just a really, really nice result.
Yeah, I love it. She just looks so